It's really interesting. I think clients and people intuitively sense that. If you haven't, as a therapist, worked through enough of your own shame, say about sex or whatever, like is a really shame-prone thing, clients sense that in therapists. I think that happens really unconsciously, and then that safety isn't there, so it won't come up.
Yeah.
Yeah.
Yeah, it makes me think of, that idea that, and this is why it's so important that therapists do their own therapy.
Right.
I just think, I don't know how I could have been a therapist if I hadn't done my own therapy. Because if I can't hold my own shame, for example, the client's nervous system knows that, and it's not going to let their shame come anywhere near the surface in a session with me, or their woundedness.
Yeah, that's a whole other topic, isn't it? Like,
Yeah.
because that's not part of every therapist's training.
Yeah.
Yeah.
Yeah. I think it's one of the real advantages of psychotherapy, the requirement
Right. Yeah.
of therapy. And I think a way that all therapies could be improved is, and something that I would always recommend is that people find a therapist who has done their own therapy, and you can ask them. And it's such a huge investment that clients are asked to make, not only financially, which is also, obviously a big investment, but their time, the time they take to make the appointment, to find the therapist, to make the appointment and come and see the therapist, but the emotional investment of so many clients I talk to who say, I'm just sick of going in and telling my life story and then feeling like this isn't the therapist for me, and then I have to start all over again. Like, it's exhausting emotionally.
Yes.
Yeah.
Actually, that makes me think some of the consistent feedback I get from clients who've seen therapists before is they're too passive. Like, I'm hearing that over and over and over again.
Yeah. So it sounds like they're looking for someone who's stepping into the space with them.
And collaborate, right? Like, how are we going to work towards your goals together? Like, what does that look like? So ideally, the therapist can adapt at least somewhat and be flexible based on what the client needs. I don't think we're taught that really very much at school. But if you can find someone that's able to do that for you, kind of meet you where you're at, and you feel engaged in the process, the goal setting, you feel like you know what you need to do between appointments, all of that was more and more important.
I feel like a lot of people maybe don't go to therapy because they wonder how talking to someone could possibly help. And I think when they're wondering that, I think they're imagining that the therapist sits there very passive and just listens or just affirms even. That's not what you're describing that therapy is with you.
No, well, there's a bit of that, and I kind of feel like it's lazy, to be honest. Like, because you could, right? Like, you could, based on our training and other trainings I've had, you could legitimately sit there and not do very much and take people's money and call it therapy. And some people really need that, but you need to be like really explicit with people. Like, what do you need? Do you really need me to be like a very open listener and kind of let you tell your story and kind of sit back?
So that could be what somebody is coming for.
Right.
But you would name that and check them. Is that what you're here to do? Is that?
That's right. Like, try and get on the same page about that. Because I think what you're saying is people, and I've had this experience as a client, like, you go and there isn't much direction. It's like, just talk. And then that's where like therapeutic drift happens. And you like, why am I going again? Like, you go.
What's therapeutic drift?
Well, therapeutic drift would be like, so that's when there isn't really a treatment plan, or there is, but you've moved really, really far away from it and you're not sure what you're treating anymore. the client keeps coming because maybe they like you and it's nice to talk with you, but the goals have gotten really loose, or there's not much focus or intention about why you're both there.
And the client doesn't necessarily know how it's supposed to go, right?
No.
So the client could keep coming for a year and just talking and be thinking, okay, well, I guess this is what it's supposed to be. I guess this is what the therapist is doing. So
Yeah. Yeah, that's
this is
right.
what we're doing.
Yeah. And then I imagine you, over time, if that keeps happening, you get cynical about therapy and will give up. Like, you're like, I've tried. And lots of people
Think
have.
about how much money you've paid over the course of a year and wonder what you got
Right.
for it.
You can't. That's one of the reasons I use outcome scales, is because it's a visual reminder of what we're doing and if the client is improving or not. And so there is something tangible for the client.
Yeah, so it's explicit and clear
Right.
what we're doing, where we're going with it, what we're noticing, where we are on the journey towards where we want to be.
Mm.
And that the therapist and client are both active participants in the session. And I really name constantly kind of coming back to, something will emerge in the therapy and I'll name, this is what we're talking about, or this is what you mentioned in our first session of where we want to go with this, and we can track how far we've come along that
With that
journey.
particular topic.
Yeah.
Yeah.
It shouldn't be a mystery to the client how they're going.
You would hope not, but like sometimes it is.
Yeah.
Yeah. Like, and then there's also this, I imagine it's sometimes like, well, I'm doing something, like I'm going, but that in my experience isn't enough for people to see the change hopefully they want to see. So how do you elicit someone's motivation? How do you engage them in the process?
What should a client do if they feel like they're in a therapeutic relationship where they feel like nothing's happening?
I would suggest they talk with their therapist first about it. And maybe like you said, have some things written down that they can refer back to, kind of more and more. I'm trying to encourage clients to bring notebooks and see how the therapist responds. If you get a bit of a defensive response, that's not a great sign. Ideally, your therapist can take on feedback and adapt. And it's not to say that every therapist is it's not going to be the right fit for you. Sometimes it might be an ending or closing session, that discussion. But first of all, it's a great skill development to tell someone in general, I'm not happy, this isn't really meeting my needs, I didn't feel heard or understood. I don't understand why we're talking about this topic, why we're talking about my childhood again. I don't understand how this is relevant to my relationship now, etc. To talk with them, see how they respond.
Yeah, and ideally the therapist would respond by really hearing the client out and asking more questions about what it is that they need, what it is that they're noticing isn't working. And as you say, if you're finding the therapist gets defensive, or if you feel like their body's seizing up and they're getting a bit offended, I'd say that's a bit of we're human. That might happen for a moment. I don't know. But I'd say it's a bit of a red flag.
It is if you can't own it in the moment, right? So if you were seeing me and you're giving me feedback and I said something a bit defensive and then couldn't notice that and own it and then redirect it back to you, that's, I think, the problem.
Well, if the therapist could own it, would that be something like, I notice I am feeling a bit defensive because I want to be a really good therapist for you.
Right.
Something like that.
Yeah.
Yeah.
Yeah, that would be nice to hear,
Yeah.
I imagine, for a client. Yeah.
Yeah. Yeah. I feel like even myself as a client, even though I'm a therapist, it would be really hard to have that conversation. And I think so many clients would rather ghost than to actually have that conversation and
Yeah.
say, I don't know if this is working for me.
Hmm.